Good morning, everybody. Thank you so much for attending this ACEs webinar training. I would like to hand it over to Kelly Crane from PCA America. Thank you.
Good morning, Rhode Island. I'm very excited to be here with you all. I'm sorry, I'm trying to pull up my slides as we do all this. Anita, do you have control to let people into the room too?
I
Okay.
do, and I've been doing it, yes.
Thank you. I just saw it popping up. So as people are jumping in, so this is exciting. Well, good morning. We are really honored to be here, Anita and I, from the National Office of Prevent Child Abuse America. And I have some slides that I will pull up in a second, but I've heard there is snow where you all are. So thank you for joining us and sticking through it. And I hope that you all are safe and warm. And that your internet doesn't go out through all of this, because that happens too. I live in Minnesota, and so I'm used to snow, but not 32 inches, as Philomena let us know you guys have. So glad to see you all. I have Anita on the phone, on the line, and then me, and then also Jordan Watts, who is our Masters of Social Work intern at Prevent Child Abuse America, who's going to be, you might see her drop things in the chat and help us with all things technical as we walk through this webinar. So I'm going to share some slides with you guys. Do you all see that?
Yep.
Okay, awesome. Thank you. And I lost your faces, so please interrupt or speak up if anything, if you want to share anything as we walk through these. So as Philomena introduced us, today we're going to be talking about ACEs and strengthening well-being. And what we're going to cover, so many things going on my screen. All right. Again, excited and grateful to be with you all and share what might be an introduction to some of you and maybe overview for others around adverse childhood experiences. And then want to talk over the next 2 hours together, break down what ACEs are and really how early adversity can impact development and long-term outcomes. And then also talk about what positive childhood experiences are and how they can buffer or mitigate ACEs, highlight why prevention matters, and touch on a few practical evidence-based solutions to strengthening families and communities through policies and different prevention strategies. And then we also want to share what we're calling at Prevent Child Abuse America the Blueprint for Family Wellbeing. We've been working on it for, oh my gosh, probably 3 years now. So just want to share that with you guys and how maybe that can be used to create in your own state an ecosystem for prevention and think about prevention a little differently. And then lastly, we want to leave you all with some clear insights and actionable ideas to help create healthy environments where all children can thrive. And throughout this, we have a few interaction points and quizzes. We'll have a breakout room towards the end for just a really short breakout room to give you guys a little break from hearing us talk and talk to each other. But really thankful and excited to be here and grateful to be invited. Oops, sorry. So before we dig into what Prevent Child Abuse America is and what the work that we do, and before we dig into the presentation, just want to share a little bit about ourselves and learn a little bit about who is also in the room. So I'll introduce myself, Kelly Crane, the Director of Policy and Government Relations at Prevent Child Abuse America. And I'm from Minnesota. Our national office sits in Chicago. Anita and I are 2 remote staff, so I sit outside of Minneapolis. I'm a mom of 2 kids. I have a 14-year-old daughter and a 10-year-old son who I just got off to the bus. My son, we almost missed it, but he caught the bus this morning. And just really grateful for this work that I get to be a part of and grateful to be in this space with you. And I'll let you introduce yourself, Anita.
Thank you, Kelly. Good morning and welcome, everyone. I especially wanted to recognize this morning all the amazing parent leaders that help us in this work that we do in prevention. Especially wanted to recognize the fact that our chapter in Rhode Island is led by parent leaders. So thank you all taking up the prevention role in your communities and in your neighborhoods. We couldn't do this work without you, and we really appreciate your efforts to advance this work in community with you. So as Kelly said, I am also a remote employee of the national organization. I am the national director of state chapters. So my work not only aligns with the policy team or the research team, but really focuses on the development of state chapters and supporting the chapters with technical assistance and coaching in the areas where they would like to build further capacity. in their respective states. I have been in prevention since 2004. And I started my prevention journey with the Answer Prevention Fund of Florida. I stayed in Florida. Later on, I led the PCA Florida state chapter before I joined the national office in 2015. I do have two young adult children. My daughter is 24 years old and works full time as a financial planner, and my son also works almost full time, but he is finishing a finance degree at Florida State University. So he'll graduate in December. Parenting is the most rewarding and the most difficult job in the world. And I have to say that because I grew up in poverty and under oppression, that is my personal relationship to our mission at Prevent Child Abuse America. So with that, I think I will talk a little bit about Prevent Child Abuse America. I want to start by recognizing our mission and North Star. Our mission has not changed throughout the years. It is to prevent the abuse and neglect of our nation's children before crisis occurs. And we have a vision to reach our North Star, which is to ensure that all children and families are living a purposeful and happy life with hope for the future. So how do we do this work at Prevent Child Abuse America? Our approach involves a number of departments and divisions. So the next slide will show you the two key networks that we have, which is the state chapter network. Are you able to advance the slide,
Yeah.
Kelly? Okay.
Sorry.
Good.
Oh my gosh. There we go. It's really slow.
Oh, thank you. Thank you. So our approach really boils down to these six major buckets. We have two key networks within the PC America umbrella, the state chapter network. We have our evidence-based signature home visiting program, Healthy Families America. We also have a research team that does a lot of research around correlation between child maltreatment and paid family leave, child maltreatment, and
it didn't fall out. I picked it up and it.
Sorry, I muted somebody. The correlation between child maltreatment and quality and affordable childcare subsidies, corporal punishment, and just to name a few. We also believe that public awareness is really important and critical in our work. How do we shift the narrative so that people understand what prevention is and see themselves having a role in this work? We also have a really strong, small but mighty policy team, including Kelly. We do federal policy, state level policy, and we also have a policy specialist specific for Healthy Families America as a program model. And then overall, the strategy team tries to coordinate all of the work under these individual buckets. How do they align and feed into the blueprint for family well-being that Kelly mentioned and we'll also talk about later on in the presentation. So I think at this point, I will hand it over to you, Kelly, right? Oh, no. There's one more. There's one more that I'll cover. So this is a slide that we pulled from our digital annual report last year. Basically what we wanted to show you is that we do have currently 46 state chapters and the state chapter in Washington, D.C. And we do rechartering and chartering site visits each year. So those numbers are not really relevant to this particular presentation. But we also wanted to highlight our other key network, the Healthy Families America Network, which has over 600 sites in the United States, the 5 U.S. territories, and in Israel. We do have a team in Rhode Island of our HFA team. So we want to make sure that you all are connected because there is so many strategies related to primary prevention that you all could partner and collaborate around. So we hope that you have those connections. If you don't, we'd be more than happy to make those connections for you so you can be more effective in your local community efforts.
Okay. We're going to attempt to do a quiz, and I hope this works. Just along what Anita was mentioning, that wanted to get a better understanding of your connection to the two networks that Prevent Child Abuse America is made up of, specifically your connection to Prevent Child Abuse Rhode Island or an HFA site in your state. And then also wanted to know what brought you to this conversation, whether you have a personal connection, professional role, or you're just curious. So if you take out your phone, you should be able to use the camera feature and then click on the link and answer those 2 questions. And if not, we can probably drop in the link to that as well. Give me a second as I try to pull up your responses. Okay. Oh, you guys are on it. Many are responding already. All right, great. So many are familiar with the Parent Support Network of Rhode Island, which is our child abuse, Prevent Child Abuse Rhode Island chapter. Some are can't wait to learn more about this work and about the connection between the 2. It is uploading as you guys are seeing it, so sorry if that is wild to see. And then just a lot of content will support your professional role. That's fantastic. We hope that you will walk away with some items that you can take back into your professional role as well. All right. So most are familiar with Prevent Child Abuse Rhode Island. Thank you for that context. And then we can share, at the end, we'll share a lot of resources too, but to find out who your Healthy Families America, our evidence-based home visiting model is in your site, if you would like to get connected and learn a little bit more about them, we'll make sure to share that with you. Okay. And some are familiar with both. Fantastic. All right. We'll take that away and then we can come back to, oops, I'm not good at multitasking. We can come back to that as well later as you guys answer those. Thank you for engaging and I'm playing along with the quiz. We appreciate it.
Yes, I agree.
Yes.
It's always good to know who is in the audience.
Mm-hmm. All right, so we'll dig into what are ACEs, what are adverse childhood experiences. You hear me say adverse childhood experiences or ACEs. And Anita mentioned our North Star. It was in one of the slides with the little boy. And I'm sure it's one that we all share, that all children and families deserve to live a purposeful and happy life with hope for the future. And that is really kind of our North Star of the work we do. I'm sure it is centered in the work that you do as well. And we work at the national level with all of our partners, our Healthy Families America sites, our Prevent Child Abuse state chapters, and other partners really to prevent adverse childhood experiences or ACEs, which are those traumatic or stressful events that can happen in childhood, like child abuse and neglect. And those really shape health and well-being outcomes across lifetime. So we also know that, as Anita said, parenting is one of the most rewarding and toughest and challenging jobs anyone can have. And we also know that most parents want to be really good parents, but want to be good parents and are good parents, but overloads of stress, generational trauma, systematic inequities can all take a toll on parenting and getting through day-to-day lives. But with the supports and with positive childhood experiences in childhood, children are more likely to be healthier and happier adults, which then in turn contribute to a more productive and prosperous society for all of us. And we also know that there are strategies to prevent or mitigate ACEs and that can help prevent poor health and life outcomes. So we will dig into those as well throughout this presentation. And I think we have another quiz for you, another pop quiz. This is, so use your phone again. There's 5 questions this time. And it's really, there are right answers, but there are no right or wrong answers right now. It's just really to kind of level set and get an understanding of maybe your knowledge or understanding. Thank you, Jordan. The link is also in the chat if that's easier to do on your computer as you're watching us. But just wanted to kind of get a level set of what are ACEs, what are positive child experiences, and hopefully if you're struggling with any of these 5 questions, you'll hear us talk about them throughout the presentation and pat yourself on the back or understand that you the right answer. So just wanted to again, level set. I will not share these on the screen and call anybody out, but afterwards we can view the responses and kind of walk through this. So I'm going to give you guys a second to do it. And it looks like you guys are very busy in there, so I will pause and let you keep responding. We need like the Jeopardy music or something. It looks like well over half of you have responded, but please continue to fill that out just to kind of help us. We'll look at those and gauge where you all are and hopefully answer some confusion as we walk through the presentation.
Thank you, Kelly. And we can't help it. This continuous quality improvement is part of who we are and part of what we do. So we always think about bringing value to everything that we do. So this is hopefully will help you to see how much knowledge perhaps you are able to gain from this particular convening this morning. So as Kelly said, we're going to now dive into ACEs, and adverse childhood experiences are events or circumstances that may be traumatic to children during the first 18 years of life. Childhood trauma affects health across a lifetime beyond childhood. Traumatic events are common. We need to face that they are very common and can have lasting effects on a person's life and health and on a community's well-being. The effects of trauma goes far beyond its immediate psychological and physical effects. Experiencing trauma can alter an individual's biology and behavior across lifetime. Ultimately, traumatic events alter the well-being of not only individuals, but also our communities and society. How a person responds to trauma is complex and dependent on many factors, including the resources of the individual and their supporting relationships and community. Now, how did we learn all of this? In 1998, the CDC published a study called the ACEs study. The study itself surveyed more than 17,000 individuals about child abuse and neglect and other adverse childhood experiences, those that are included in the ACEs official questionnaire. The survey results, together with a physical examination, formed the baseline data for the largest study of its kind to date about childhood adversity. ACEs are categorized, as you see on this slide, into three groups: abuse, neglect, and household challenges. Each category is further divided into multiple subcategories. As you see, under abuse, we recognize physical, emotional, sexual abuse. Neglect could be physical, emotional. Household challenges include mental illness, family violence, divorce, incarcerated relative, and substance abuse. So we know when children are exposed to chronic and stressful events, I think we can move to the next slide, Kelly, their neurodevelopment can be disrupted. As a result, the child's cognitive functioning and ability to cope with negative or disruptive emotions may be impaired. Over time, and often during adolescence, the child may adopt unhealthy coping mechanisms such as substance use. Eventually, these coping mechanisms can contribute to disease, disability, and social problems, as well as premature mortality. This slide depicts the lifespan impacts of ACEs. It's important to note, as most of us know, that the brain development, 75% of brain development happens in the first 3 years of life. And while the frontal cortex does not develop until we are 25, the second period of accelerated brain growth is happening during adolescence into early adulthood, where ACEs and positive childhood experiences can continue to play a role and have a lasting impact. So, as I said, ACEs are common and the effects can add up over time. Many people do not realize that exposure to ACEs is associated with increased risk for health problems across the lifespan. Individuals who experience ACEs are more likely to have negative physical and mental health outcomes throughout life, including chronic disease like diabetes, cancer, and mental health issues like depression. I am going to let some people in, because they were in the waiting room.
Thank you, Anita.
Oh, of course, no problem. And so, as I mentioned, many of these negative outcomes associated with ACEs are among the top 10 leading causes of death in the US. And through the ACEs data reports, we actually learned about ACEs data overall in the United States. So the next slide will show you what we learned from these data reports. 61% of adults have experienced at least one ACE. 1 in 6 adults have experienced 4 or more types of ACEs. At least 5 of the top 10 leading causes of death are associated with ACEs. And we also learned that prevention of ACEs could reduce the number of adults with depression by 44%. These are real numbers when we look at the United States of America. So now, what does this mean by the numbers? In 2019, the CDC published the Vital Signs Report. Our own president and CEO, Dr. Melissa Merrick, was the author of this particular report. And this report tells us that preventing ACEs can reduce, you see, up to 21 million cases of depression, 1.9 million cases of heart disease, and up to 2.5 million cases of overweight and obesity in our society. And I think now I turn it over back to you, Callie.
Thanks, Anita. I recognize that I probably want to pause. That was a lot. Any and there's some stuff going in the chat that we're trying to keep up with, but any reactions or questions or things you've heard before we dig into Rhode Island and ACEs? I think it's a small enough group that if you want to come off mute, then that's fine.
I have a question.
Yeah.
Is there any data on the efficacy of ways of mitigating ACEs in early childhood?
Yes.
Yes.
Excellent
And
question.
we've
Am I
excellent
jumping
question.
ahead?
Yeah, you are. You're on the path.
Oh, sorry.
No,
Yes,
Anita
we
will
will
definitely
be-
get into that later, positive childhood experiences and all the study behind that. And then we'll talk too about some of the strategies and policies that are proven to mitigate.
Thank you.
Yeah. Yeah. Thank you. All right. So just wanted to share Rhode Island and ACEs. So Anita shared that nationally about 61% of adults state they've experienced at least one ACE, which closely mirrors the experience of adults in Rhode Island, where approximately 63%, it's not on the slide, but approximately 63% of Rhode Island adults have experienced at least one adverse childhood experience. And then Anita also shared that about 1 in 6 adults reported experiencing 4 or more ACEs. And this is also mirrors the experience of adults in Rhode Island, where about 16%, the same, are reporting experiencing 4 or more ACEs during their childhood. So this really reaffirms that what Anita said, that ACEs are common, they're widespread, that lots of people experience traumatic or negative events as kids. And if you do, it can make it more likely that you'll have health problems, maybe have some emotional issues or struggle with things when you're grown up. And because ACEs are common, and since they can happen to so many people, it can cause these later life outcomes. To Hero's point, researchers continue to explore ways to help prevent it and to help those who have been through adverse childhood experiences. So what we have learned, and we will dig into it much more, is that there are protective factors that balance out those negative experiences, and that there are things in positive childhood experiences that balance out those negative experiences. So the impact for all is not equal, as Anita alluded to as well. So this is just what we found, a really good resource. Jordan will drop in the chat, I hope, a link to that gives you more information than what's on the screen about ACEs in Rhode Island, including how they don't affect everyone equally, and some ideas in Rhode Island specifically for how you all are addressing and preventing ACEs in your own state. But just wanted to make sure that you guys saw this, that reinforces the national scope is very similar to what is happening in Rhode Island, and that is common across almost all states as well. So what we know is that the root causes of adverse childhood experiences or child abuse and neglect are not bad parents. It's adverse community conditions like that intergenerational poverty, lack of access to healthcare or childcare that are the root causes of the stressors that could impact child abuse and neglect. And we'll share a little bit more about that, the tree later, and kind of what are those root causes as we dig into some of the strategies to mitigate those. So we also know this is a visual that came out of you're going to see a video next, a visual that came out of an effort called Building Better Childhoods, where really when you can see the impact of what rent and car payments and childcare and debt and that impact that it has on families and the weight that it has on families can be really heavy, and families can feel overloaded. But when we can, lift up some of those weights, families are better able to parent. I'm going to attempt to now share a video with you guys. This is from the Building Better Childhoods, and I don't believe I gave you the link for this, Jordan, but we can get this link to Philomena as well, because it's a website created with a lot of good information, but a quick video that I hope works for y'all. It's a minute and a half around. Yes. Oops, you don't have my other screen, sorry. All right.
The key to happy childhoods is providing children with the loving support they need. And the key to ensuring they get it is providing parents or other primary caregivers with the support they need. Because parents can parent better when they're not overloaded with the financial, emotional, and societal burdens that life can bring. Emotionally healthy caregivers foster healthy childhoods, which in turn create healthier communities. That's why it's up to all of us to play a part in reducing the obstacles to good parenting. It starts by realizing that childhood adversity, including child abuse and neglect, is a public issue. It's our responsibility to help give children the chance to flourish. And one way to do it is to enact policies and fund programs that address poverty, racism, mental health, substance use disorders, and other key stressors that can affect families. Childhood adversity is preventable. By focusing on the circumstances that lead to abuse and neglect, we can protect children's physical, intellectual, and emotional development and allow them to reach their true potential. By putting policies in place now that strengthen families and promote well-being, we aren't just helping to prevent the issue of childhood adversity, we're helping to solve it. Building better childhoods starts by building a better foundation for parents and other caregivers. It's what every child deserves. Find out how you can play a part by visiting buildingbetterchildhoods.org.
Well, there's the website, buildingbetterchildhoods.org, if you guys want to check it out. I wanted to share that video with you. One of the answers to the quizzes was in there that ACEs are preventable. I will turn it to Anita.
Thank you, Kelly. So one of the things that happened in the prevention industry after we learned about the ACEs study and people started to collect data around ACEs, and we did trainings and people recognized and understood their adult behaviors, how they are related to their childhood. But then we started hearing these questions from communities that, now what? We know that our lifespan might be shorter than normally would be based on the number of adverse childhood experiences we had, but what can we do? Now, the good news is that adverse childhood experiences, as we said it a few times, and their associated harms are preventable. Creating safe, stable, and nurturing relationships and environments can prevent ACEs and help all children reach their full health and life potential. We also know that when we prevent ACEs, we also prevent potential later involvement in violence, substance use, depression, and suicidal behavior. We reduce the risk of other health challenges, as we mentioned, like cancer, diabetes, and heart disease. Now, the next image, Kelly and I both love this image because this image really illustrates that if the positive experiences, particularly early in life, balance out or even overbalance the negative experiences, we can also see positive outcomes overshadow negative outcomes. And this is a great image when we talk about, folks, not just about their adverse experiences, but when we start digging into the positive experiences, then we see that how these adverse effects were mitigated by some of those positive experiences. So the key to happy childhoods is really providing children with the support they need while they are developing. And the key to providing this loving support is to provide parents with the support they need to be healthy parents. Parents can parent better when they aren't overloaded, like Kelly said, with the financial and societal burdens that life can bring. So child abuse and neglect are preventable. We also recognize that certain factors may increase or decrease the risk of perpetrating or experiencing child abuse and neglect. And in order for us to prevent it, we must understand and address the factors that Kelly mentioned that put people at risk for or protect them from violence. So everyone benefits when children have safe and loving and stable and nurturing environments. Um, so some of the questions Hero raised about what can we do and how do we mitigate these effects. So let's spend a little bit of time on how we can use and promote positive childhood experiences. So one of the study that we wanted to mention here is in 2019, a John Hopkins study identified 7 positive childhood experiences that can buffer against adverse experiences and boost resilience in adulthood. So what's interesting when you look at this list is that small and seemingly insignificant actions that happen every day actually create positive childhood experiences. So the 7 positive childhood experiences, these that are listed here, can be statistically linked to good emotional and mental health in adults. I'm not going to read them out to you, but these are things that we can think about when we do our everyday work. And we can ask and probe questions with our clients, with our partners, to make sure that when they talk to families and caregivers and community members, they bring up, that do we have an opportunity for these experiences? Because as you can see, these include things that make sure kids and families have good support and places to grow. And while we know that stress and trauma during childhood can have profound effects on development, both physically and mentally, we also know that children with positive experiences are more likely to become healthier and happier adults. And as we know, healthy adults could contribute to a more productive, a prosperous, and flourishing society. And all of us would aim to have that. And as a parent, I'm sure you know that when your child's classmates and their friends are doing well, you know that your child is doing better. So this is the cycle of support that we want to see in communities. So this is one of the frameworks that we can recommend for folks to use in their work. Another framework on positive childhood experiences is the HOPE framework. HOPE stands for Healthy Outcomes from Positive Experiences. And this framework is grounded in the idea that promoting positive childhood experiences is just as important as preventing the adverse ones. What this framework does, it really combines a public health approach to preventing child abuse and neglect with a broader understanding of how children grow to become strong and healthy adults. They have this core assumption under this framework that the positive is real. It already exists in people and cultures and can be developed and expanded and replicated. But Hope also drew on the Center for the Study of Social Policy's family level protective factors. Kelly mentioned those earlier, which I will also mention in a little more detail, as well as with the CDC's Essentials for Childhood framework. Another one that I am happy to mention is the Montana Institute's Power of the Positive, which is really helping to establish those positive community social norms. So all of these positive frameworks have really helped Hope to be developed. And really what it does, it provides that common language to describe the kinds of experiences that can counteract with the adverse experiences. The Hope framework has identified the 4 building blocks of hope. You see it on this slide. They are relationships, environment, engagement, and emotional growth. This approach really aligns powerfully with primary prevention strategies in child maltreatment policy that we will cover later. Kelly will go into more details. What we can do utilizing the framework of the 4 building blocks of hope. Because primary prevention isn't just stopping harm before it happens, it's about creating the conditions, being proactive about it, so that those conditions where families raising their children are existing so that they can thrive. And that is exactly what hope is about. And so, as I mentioned, the a study for the Center for the Study of Social Policy has the Strengthening Families Protective Factors framework. It's based on research that identifies promotive factors, which not only reduce the risk, but actively build family strength. Originally, they focused on early childhood 0 to 5, but then approach is now applied to various child and parent serving organizations, including the Youth Thrive framework, which really addresses ages 9 to 26. And what we've learned through their research is that increased presence of the protective factors directly correlates with lower rates of child maltreatment and better overall well-being. So what this means is that the families who are having the same risks, those that had some of these protective factors, they were better able to deal with the daily stressors, and they were better be able to face those challenges and stay resilient in times of hardship. So the protective factors themselves, we listed them on the next slide. They are parental resilience. It's what I mentioned, that how do you function under, stress or during challenging times? The social connections are very critical, having those positive relationships in your neighborhood, in your community, in your school. The knowledge of parenting and child development, understanding that what are the right ages for toilet training, or what do the terrible twos mean, and what are the expectations, of children as they develop, and how can you support their physical and cognitive language and social skills to develop. Concrete support in times of need, that's one of the basic things that we see across communities, that if we could give those concrete support in times of need in their own communities without stigma, families don't face the crisis that they would have to enter child welfare. And then the social and emotional competence of children, again, it's really important because the family and child interactions that help children develop the ability to communicate their feelings, recognize and regulate their emotions, and it will help them to establish and maintain, positive relationships throughout the lifespan. Back in the day, we had another protective factor, the nurturing and attachment. But I think we've learned that nurturing and attachment as a parent is going to carry us throughout our lifetime, because regardless of how old our children are, we will continue to nurture and attach them. We are going to continue to nurture them and being attached to them, but in different ways in adulthood versus when they are infants or toddlers. Let me end. Some people are in the waiting room, so I am going to admit them. Welcome. And then the last framework that we are promoting to agencies and organizations to consider when they are thinking about the positive experiences for children and families in their communities, it's the CDC's Essentials for Childhood framework. This framework promotes safe, stable, and nurturing relationships and environments, which are, we know, essential to prevent early childhood adversity, and ensuring that all children reach their full potential. The strategies for communities to promote these type of engagement and relationships are listed here under the 4 goals. And these goals are really intended for anyone who works in the prevention industry, because you are committed to the positive development of children and families. And while each of these goals are important and you can work on just one or maybe 2 of them, what we have seen from state level work, the 4 goals together are more likely to build the foundation of those safe, stable, and nurturing relationships and environments in communities. So sometimes we see this, that one organization may lead the public awareness piece, another organization, maybe Kids Count, is the one that's looking at the data and helping you to put the data into the messaging that you want to put out in your state. You might have an organization that really promotes the social norms. So it could be a local collaborative at the community, county, regional, or state level when you think about this framework. And then I think we're going to show another poster from the Building Better Childhoods Toolkit. Kelly shared this. It was really important for us after we got the recent recommendations from frameworks. How do we need to communicate about child abuse and neglect? We recognized that we really needed a toolkit, something concrete that agencies and chapters can just plug in and utilize. So this is how we are learning how to reframe our messaging that might resonate with policymakers and decision makers. So instead of saying childhood diversity is inevitable, we should say childhood adversity is preventable. Instead of saying childhood adversity is unsolvable, we should be reframing it that no, childhood adversity is solvable. And the last example here is child neglect is a parenting issue. A lot of times we hear, the stories that, oh, this person was amazing, boots on the ground, they pull themselves up by the bootstrap, but they are not recognizing that not everybody has the opportunity. And unless we change systematically the opportunities that are more equitable and more accessible to everyone, then we can recognize that child neglect is a public issue and we all have a role to address this. So these resources are available to chapters to utilize. So if any of them resonates with you, or you feel like that this could be something that you could use in your community, feel free to contact the chapter or just go to the Building Better Childhoods website. You can download the toolkit and the posters and utilize it for your public awareness efforts. And then I want to just close out this section and saying that while child abuse and neglect is a significant public health problem, we all agree that it's a preventable one. The steps that are suggested in any of these three frameworks that we shared with you, along with your commitment to preventing child abuse and neglect, can help create neighborhoods and communities in a world in which every child will thrive. And addressing the root causes often involves research findings, translating research into messaging and recommendations based on research to those decision makers and legislators to ensure that we are fostering a healthier, a more equitable and prosperous communities across the nation.
Thank you, Anita. I'm going to go off script and pause and see if there's any questions, any thoughts, any comments. I know I have one. So I'll kick us off. I just wanted this whole discussion around positive childhood experiences and the frameworks and protective factors are so important, and it is what we lean into in a lot of our work so that we understand how we can mitigate and prevent ACEs. Just those, I never heard Anita say this, but those 7 positive childhood experiences, how they are simple interactions, but the impact that they have on kids in later adulthood are huge. Any of those simple interactions and those relationships actually like form neurons in your brain and new attachments and new things. So they make your brain on fire. So anyway, those are all really important protective factors. Just before this call, we were talking, and Philomena and Brenda and Anita and I were talking, and even as adults, these interactions are important. Anita was getting some praise for some work that she had done, and you could just see Anita feel good and boosted. And so those interactions also impact us as adults. So anyway, just wanted to share that perspective. But if there's any thoughts or comments, feel free to, and we should probably jump to the chat. We've been trying to answer some of the questions. If we have missed any, feel free to jump off. But yes, there's a question about, are there any states that have used ACEs study to inform policy and practice? Lots. And so we'll get to that later in the discussion as well. But yeah, a lot of states, there's been a lot of work just around building awareness and educating around what are ACEs so that we can build the foundation for how do we mitigate and prevent those. So there's been a lot of work around using ACEs as a way to inform policy and practice. And Tyrone, I see that your hand is up, so I'll let you jump in.
Is it? Oh, this is Tyrone. I'm sorry.
No,
is it as important for adults to take part in social emotional learning in support of their children?
I actually was just about to type the answer in the chat, Tyrone. So thank you so much for your question. Absolutely. What I was about to respond was that depending on our upbringing, we may not have been able to learn how to regulate our emotions as a child. And so it is never too late to learn emotional regulation. It is really important, especially when you are raising a child, because the child will replicate and will learn from your responses and your behaviors. So it is really key, especially if you recognize that you are having a hard time regulating your emotions. I recommend to talk to a therapist and figure out ways in which you are able to um, learn how to regulate the emotions before you would respond to any interaction with a child that might be needing correction. So it's never too late. I recommend everybody to take an inventory, because regardless, life brings us challenges day in and day out, and we need to be able to have these tools in our pockets so that we can be okay, because without us being okay, we can't be there for all others. So I hope that helps, Tyrone.
Thank you, Anita. And I know we're not talking much about home visiting programs, but that is a Healthy Families America is one example of an evidence-based home visiting model that really does that for parents, that provides that support and relational development and knowing when to take a break and things like that. So there are a lot of programs out there that support parents that need all of us need. That's
I just want to say hi, I'm Marie. I'm from Parent Support Network as well. I think that was a good question, Tyrone Max, because I think a lot of, well, not I think, but I feel a lot of emotions, adults don't know how to regulate, and education starts at home, and the kids learn a lot of how they see their parents and they imitate. So I think, that's a great question, Tyrone asks. I wanted to ask the data that was collected in Rhode Island, was that data that was reported, or what that's data that was out obtained within the community, or how was that data collected?
a really
I
good
think
question.
it was the behavioral risk factor survey. So this is a survey that each state used to administer. Unfortunately, now it's not required. The CDC was able to require every state to collect this data. So I think even the slide that we had, I think the data was from 2020. I can't remember, because right now it's not across the nation. So some states who might be able to find the way to collect it, and the Department of Health is still able to do it, they do it. But that's how the data, it's basically a questionnaire that really assesses your risks related to behavior. And that's collected in the data sets that we were able to present to you, that's specific to Rhode Island and nationwide. But I don't think we had recent overall national data. Unfortunately, it's very fragmented.
Oh, then that means that data must be much higher now with the impact of how certain communities are living in the poverty and everything. So, okay, thank you for that. I
Indeed.
appreciate that.
Absolutely. Great question.
Yeah. There's also a comment about the Campaign for Trauma-Informed Policy and Practice, CTIP. We sit on that coalition as well. They do a lot of advocacy around trauma-informed policy at the federal level. They have a great website too, that just stay informed and use their tools around what is trauma-informed policy, and what can that look like at the federal level. They do a little bit of state work too, but mostly federal. And talk a lot about positive childhood experiences and resilience, and how do we build those up through policies and practice and research. Thank you. All right. Attempt to share my screen again. Okay. All right. We're gonna dig into some of those policies and practices and that are impacting positive childhood experiences and adverse childhood experiences. So we know that there's a range of policies that all play a really critical role in supporting families. So helping them to meet basic needs, access opportunity, build long-term stability, from housing to healthcare to education, economic security, all our policies really that shape the everyday experiences of families. Sorry, guys. lost your faces. There we go. Okay. So another video for you all. Just really, this really digs into. It's on our website, Prevent Child Abuse America's website, and it's a new video that really talks about how to build that foundation. So just wanted to share this with you all before we dig into some of those key policies that are driving those positive change and reducing barriers and strengthening families across communities. So at the core, this video also touches about at the core that prevention is really about creating those conditions where adverse events like child abuse and neglect are less likely to happen, and where safety and connection and well-being can really thrive. So I'm going to share this with you all. Just a second. Oh, that did it. Okay.
Building a strong family is like building a home. The love and bond between parents and children form the walls and roof.
Apologies. I wanted to make it bigger for you guys, but I don't know how. Okay, well, we'll just do this.
Building a strong family is like building a home. The love and bond between parents and children form the walls and roof, creating shelter, all rising from a solid foundation. But if that foundation is missing key supports, it can become unstable and weaken the family structure. Limited economic opportunity, lack of childcare and affordable health care, and unsafe conditions can strain a parent's ability to care for their children. But that doesn't mean the family is broken. It means the foundation needs to be reinforced. Resources like home visiting, mental health support, and policies like paid family leave and affordable childcare strengthen families. When we invest in the right supports before fractures appear, parents can focus on what matters most, building safe, stable, and nurturing environments where their children are loved, healthy, and have hope for the future. We all have a role to play in primary prevention. Find your role today.
Thank you. Too many things open on my screen.
Such a great video. And we've got a lot of really good feedback. Instructors are hoping to use it during April. Thank you for sharing, Kelly.
Yeah.
It was just recently developed, so it's very new. I think we released it maybe about a month ago.
Yeah, feel free to share, use because it is a really good video and really short and to the point. It's on Prevent Child Abuse Rhode Island's website. Thanks, baby. So Anita shared kind of the negative health outcomes that ACEs can impact, and talked about how if we focus more on resources or upstream approaches and preventing adverse child experiences, we'll see significant reductions in the negative health outcomes, including, I don't know why this chart got cut off, I apologize, but this is from the Centers for Disease Control. But it shows that when ACEs are reduced, that we can see a 44% reduction in depressive disorder, 24% reduction in asthma, 13% reduction in heart disease, diabetes, reduction in smoking, and some of those socioeconomic challenges like unemployment. So just a really good chart that shows what happens when ACEs are reduced and when they're mitigated with positive child experiences. So what needs to change? There's a saying that I know I will get it wrong, but show me your budget and you'll show me your priorities. We often say that when you see where resources are dedicated to, you'll see what is being prioritized. So we know that there is a disproportionate amount of funding that is dedicated to really those downstream supports after abuse and neglect have already occurred, and that there's a very limited amount of resources directed towards preventing adverse child experiences. So what if we could change the things on the right side of you guys' screen and reduce the amount of children who experience child protective services, reduce the number of children being separated from their parents, and really support families and address their basic need in order to keep families intact? And what if we shifted the funding and resources to upstream to preventing child abuse and neglect from occurring in the first place? we know that we would see a lot of positive outcomes. So really, if we strengthen those community conditions, that we know that we can reduce the likelihood of abuse and neglect from happening in the first place. There's been a lot of research in the past few years. This is from 2021. But there's been research that indicates that for every additional $1,000 in annual per person spending that a state makes, for every additional $1,000 in annual per person spending for those that are in poverty by state and local governments on benefit programs such as cash assistance, housing, childcare, health, Medicaid, that you can see significant improvements in child welfare and economic stability. Some of those key outcomes are listed here. So for every $1,000 that a state or local government invests, you can see a 4% reduction in child abuse and neglect reports, a 4% reduction in the substantiations of child abuse, or a finding by Child Protective Services that child maltreatment or neglect has occurred, a 2% reduction in foster care placements, and an 8% reduction in child fatalities due to abuse and neglect. So those are, it's just a really good study that was in the Pediatrics Journal about how when states invest and when local communities invest in programs that support families, that really good things can happen in these communities, and that there's a significant reduction in abuse and neglect. Anita also touched on public health as a framework, and we often look at public health as kind of our framework for primary prevention. So when we think about changing the conditions or the root causes, we often think of this from this public health lens, or what we do collectively and together to ensure that the conditions in which all people can be healthy. This is from the Institute of Medicine, kind of their definition of public health. So really some examples of public health approach that we may all think of are vaccines. So disease prevention through vaccinations, or implementing safety regulations like CPL laws that can improve kind of the population level health and community safety, or most recently the use of masks to we protect ourselves, we protect others. So kind of thinking about what we can do collectively to support each other. So what does that look like? It really looks like preventing abuse and neglect before they occur, looking at it at a population level perspective, using evidence, and then really a comprehensive and multidisciplinary effort to address those root causes of violence and then build resilience in communities. And this is a new graphic that we just put together to really help tell the story of what, of what primary prevention is and what secondary and tertiary, and that they are all important. But when we talk, we're talking about the primary prevention, so really upstream. This analogy is, you've probably heard us say a few times, actually upstream and downstream. So really this image kind of gives a visual of what we think about when we are talking about upstream, so upriver, using a bridge to get over. So really stopping abuse and neglect before they occur. We know that when we can invest in those prevention efforts upstream, we can help prevent more serious problems in the future. We know that it saves taxpayers dollars later on as well. And then secondary prevention, which are really those directed at responding to risk populations. So those are activities that are when there's one or more ACEs kind of present, like housing instability, things like that, that reduce the potential crisis, and then tertiary prevention, which is also very important, but that is kind of the long-term response to stop abuse and neglect. So maybe what you would think of as foster care or child welfare. That's that tertiary response. And then also wanted to share this too. We mentioned the Centers for Disease Control, which is where we look to a lot of our work as well. The CDC is working on really building the evidence base around what works to prevent and mitigate ACEs and the consequences of ACEs, and then promoting positive child experiences. So the Division of Violence Prevention under the CDC, which now has a new name and I cannot think of it, but I will think of it. But the Division of Violence Prevention is where a lot of this work has been done. They've published a series of technical packages that really synthesize the best available evidence for states and communities to look at for preventing violence and other harms in their own state. So this is what they identified in their most recent kind of tools for action, I think it's called, resource for action. Their toolkits that they've identified in that toolkit, they identified several evidence-based strategies that can prevent ACEs from happening in the first place, as well as strategies to mitigate the harm of ACEs. So you'll see that each of these strategies also involve the promotion of positive child experiences. So strengthening economic supports, ensuring that there's a strong start for children, skills, intervening to lessen immediate and long-term harms. I won't read them all, but those are the kind of 6 strategies that the Centers for Disease Control put out to mitigate ACEs. So as one example of the strategies shared here are on the right-hand side are some policy options that really strengthen that economic support for families and promote financial stability and mobility. There's a number of economic support policies that support and strengthen household financial security, mobility, strengthen kind of the multi-generational strategies also that address the needs of parents and children so that all can succeed and achieve lifelong health and well-being. So some of these, such as the child tax credit, earned income tax credit, and paid leave programs have been shown through studies to reduce child abuse and neglect and prevent ACEs. And a number of these policies increase income while incentivizing work or offsetting the costs of childcare to help create the environments that promote healthy development. And I'm going to dig into this is a lot, but here are some of the specifics across these policies. And I recognize that these numbers are probably need to be adjusted because I used this slide last year. And I know that there were a number of bills passed across states last year around these kind of economic supportive policies. And a lot of those policies across states are being implemented this year. And I also know that a lot of state legislative sessions are in session right now working on a number of these policies as well. But broadly, approximately 28 states and DC have changed the minimum wage laws. Recently, in the past 10 years, they've increased their minimum wage. There's additionally 30 states and DC that have adopted that minimum wage that's higher than the federal minimum wage, which is $7.25. $7.25 is the federal minimum wage that hasn't been raised since 2009. And then what else? There's 13 states in DC that have implemented paid leave programs, 10 states that offer paid leave through kind of private insurance. So states make up their paid leave program. It looks very different across states. And a big shout out to Rhode Island. You all have a lot of these policies in places. You have a refundable state earned income tax. Your minimum wage just increased last year from $14 to $15. And then this year, there's a gradual last year, your legislators enacted a bill to gradually increase the state minimum wage until it reaches $17 by 2027. So exciting. And you have a paid family leave program that provides up to 7 weeks of benefits. And then that program is set to expand this year to 8 weeks through previously enacted legislation. So a lot of good things happening in Rhode Island. It was really fun to look into what was all going on in your state. And then this is just another visual, kind of important to understand that there's a really array of policy options. And depending on where your state sits, it can look very differently in how we support families. But we know that childhood adversity is preventable. It's a public issue. And one way to support that is through enacting policies that address poverty and address those key stressors that families face. So by focusing on the circumstances that lead to abuse and neglect, we can prevent child abuse and neglect. And so these are just some of them. There's a lot of them, but we've kind of bucketed when we talk about policies as looking at that maternal and child health through evidence-based home visiting programs, community and awareness. There's some states that have warm lines, so where parents can call for support instead of calling a hotline. Public education campaigns are a really good policy to put into place. Family resource centers are popping up like crazy across states as a hub for families to go to receive supports. There's those economic stability supports, and then early childhood, and then the mental health supports, so really trauma-informed care in school settings or behavioral parent training programs, as was mentioned as well. And then this is another one of those visuals that shows kind of when a mom or a parent or a caregiver is supported by family or faith groups or friends, social services, the things that reduce the stressors, they are lifted up and can be the best parent. Awesome. Sorry, one more slide for you guys. Oops. Before another video, you got a sneak peek. There's gonna be another video, but just this is another visual that we created as well to kind of summarize that what do families really need to be successful and to thrive and to be successful. That's nurturing and secure relationships, those positive childhood experiences. That families thrive when they are strong, when they're stable, when they're resilient. They thrive when there are social connections and supports, that emotional support around a family. Health and well-being, when families are physically and mentally healthy, they can thrive. And then when their basic needs are met, families are stable and more likely to thrive as well. Right. And I do have another video for you guys, but I see a lot of chat, so I just want to make sure. There's a warm line in Rhode Island. That's fantastic. I don't think I knew that. That's great. So, well, I will share the last video for you guys. This was a PSA video that we did last year. Just really kind of summarizing this as well, that when families are supported and when they have what they need, they can thrive. So I will play this video for you guys. Maybe. Sorry, guys.
Most people think child abuse is a bad parent problem.
Actually,
I can't make my screen go over this. Apologies. Well, okay. There we go. And this is a video really about that bad parent, that it is not a bad parent problem, that there's community conditions that impact families.
Most people think child abuse is a bad parent problem.
actually, the root causes may be different than you think.
Let us explain. Affordable housing for everyone.
That prevents child abuse. And access to healthcare in every community
Prevents child abuse too. And high quality, affordable childcare.
School breakfasts and lunch programs.
Paid family leave.
All of this prevents child abuse.
It's all about keeping families out of crisis in the first place.
At least 1 in 7 children in the United States have experienced abuse or neglect in the past year. Prevent Child Abuse America promotes policies, programs, and resources informed by science that help communities, parents, and kids thrive.
Because when we keep families out of crisis,
we prevent child abuse
from ever happening.
Go to preventchildabuse.org to learn more and find a local chapter in your state.
That's preventchildabuse.org. Let's solve child abuse before it ever happens.
We are now going to turn it so that you guys can talk to each other and with each other about, I will let Anita set this up, but this is a time for us all to kind of talk together.
Thank you, Kelly. I just want to mention, thank you, Mercedes, for your comment. We really felt so strong and proud of this PSA. But to share it with you, there are folks who don't believe that it is really the systemic issues that we need to address. And so we actually had to respond a few times to some comments that we received after we released the PSA last year. So we got some pushback, but I just want to mention that if you are going to share the PSA, I think one of the things that we continued universally to share is that what we said in the PSA, it's all based on research. We have the data to back it up. We didn't come up with this information. We are everything that we do is evidence-based. So just so you know, we have some talking points to if you ever come into a position where you get some pushback about this particular way of messaging, what we can do and how we can prevent child abuse and neglect. We have that available at the national office. So as Kelly said, we are now going to initiate breakout rooms for the next 10 or so minutes, and we would like you to discuss either one or all three of these questions that you see on the screen. Depending on your group and how much time you have, we want to make sure that everybody gets to maybe talk about one or some of these questions. And then this is really just reflecting back on what you've heard so far and what you've experienced, in your lifetime, and how you relate to this information now as a professional, and how you can maybe incorporate some of the new information, if there were some new information that you learned, into your current role. But start with maybe reflecting on your upbringing and your childhood, whether you had adverse experiences or maybe those mitigating positive experiences. And then when we come back, we'll see if some of you would be willing to maybe share a little bit about your conversation in the breakout room. Does that sound like a good plan? Does everybody understand what we are doing?
And it'll be about, what do you think, Anita? 10 minutes?
About 10 minutes. I think
Max?
we have that much time. Mhm.
Okay. All right.
And we
Jordan,
have
were you-
60 folks, so maybe 12. So like a group, like groups of 5.
Yeah, that sounds good. All right, I'm going to attempt to do this too, guys. I'm going to stop
Okay.
recording and then we can re-record, and maybe after the conversation we can jump back in so that we don't have to have that recorded. So I'm going to.
Which cracks it. Thank you so much.
Okay, I muted her. So it's really important for us to understand, and you saw it, that primary prevention is that upstream support families should be able to access in their communities, before any crisis. And so we recognize that in order for us to do this, we need to build an aligned and comprehensive primary prevention ecosystem in our country that really includes a diverse array of actors working in a collective way and with a shared sense of urgency. As you all know, primary prevention activities are designed for the general public, right? Because the intervention and the tertiary prevention strategies, those are the ones that are targeted certain populations or individuals with specific issues. But primary prevention is really towards the general public, to provide support, to prevent adverse childhood experiences and minimize those risks before they would occur. It includes addressing the context and conditions in which children and families live, work, and play. We know, and we say this all the time, that investing in child abuse prevention programs is a moral imperative. It is our collective responsibility to ensure that every child has the opportunity to grow up healthy, happy, and safe, and supporting prevention programs is one way to fulfill this obligation. Now, the next slide that we're showing, this is the one Kelly earlier mentioned, that we are going to show you the root causes of child abuse and neglect. And when I look at this image, I always think of like, flip the script from the root causes for support systems, because all of these conditions need to be addressed to create that environment in which we all could thrive. So if we all have healthcare, if we all have housing, if we all have the opportunity for economic mobility, if we are not discriminated, if we have equal educational opportunities, if we live in a violence-free neighborhood and community where we have the kind of social norms where we want to uplift and support families, then we are able to address the root causes and flip the script and create this aligned primary prevention ecosystem. And so the way to do this is really to aim for this ecosystem to be created in small, medium, large communities, counties, regions, states, or ultimately what we want to see is nationwide. So in order for us to kind of being able to visualize and explain to our prevention partners that how can we do this, how can we build this primary prevention ecosystem, we created and built the Blueprint for Family Wellbeing, which includes our guiding North Star that we mentioned early on in the presentation, our 4 aspirational outcomes for children and families, a comprehensive primary prevention ecosystem, and the 5 strategies that we as PC America identified that are needed to achieve the aspirations with sticking with our values and beliefs. So on our website, on this slide, you'll see it on the which basically on our website, you can access all of the documents related to the Blueprint for Family Wellbeing. Basically, pictured at the top of the slide, that one will outline our adaptive strategy process and dives deeper into all of the components that I mentioned, like the aspirational outcomes and the levers. And then the second photo is a plug and play that we created. It's a template that other organizations can use. The blueprint for us is really a promise. It's a shared vision alongside all of you, a unifying strategy that calls on all of us, our neighbors, our educators, organizations, funders, and policymakers, faith leaders, businesses, to come together and really create these conditions for our families and communities. So the next slide will show you the 5 strategies that was in the previous slide as well, but you might not have been able to read it because it was a lot smaller. I won't read these out, but I want to highlight that strategy 1 and 3 have been our priorities last year. This year, we are going to continue to focus on strategy 1 and 2, which is transforming the narrative, shifting the mindset, and how we communicate about prevention. We will continue to build and leverage evidence. That means that we will continue to do our research, and we're going to translate research into language that we can promote to advocacy organizations and policymakers so that we can create and implement those policies Kelly shared that could help us to prevent ACEs. We this year going to add strategy 2. So while we are focusing on strategy 1 and 3, we will do this by centering families as partners in decision making. And we have seen, just for your information, not only that we do this at the national level, but we have seen the use of the blueprint at the state level in different ways. Some chapters have used the blueprint for strategic planning. Some used it for board education, so the board members, especially if they have new board members that they are onboarding, to understand, the prevention landscape and all the players in it. We have seen it being used for statewide prevention planning, for convenings like conferences, and obviously for advocacy efforts with legislators. And then a lot of folks, because of strategy 1 focuses a lot about the narrative, they have used the blueprint for storytelling at many chapters in the last year or so. So these are the ways in which we are engaged currently and what are our priorities. But again, these, the template for the plug and play is available to any organization, and you can just insert your own strategies and then figure out, what does, a primary prevention ecosystem could look like in my own community? Who are the people I already have connections with? Who might not be at the table that I may want to consider to invite to ensure that, all of those levers that are impacting the families of life and lives of children and families are going to be at the table, creating, the plan that would work for the organizations as well as for the communities.
Thank you, Anita. Thanks. This is my favorite part. So I get to talk about what we can do together to make a difference in some of the advocacy things, and hopefully you guys can walk away with an action. It's been mentioned too, we often say how prevention happens in partnership, and you've probably heard us say a few times, it takes all of us, we have to work together. And here's a way that we can also work together to really share all that we know, all that our experiences, all that we've learned today with the community, with legislators, with neighbors to support them. So wanted to just talk a little bit about policy and advocacy and what that can look like. And taking a step back too, that every piece of legislation really starts with an idea. And that idea can be from a legislator, a staffer, a lobbyist, or us. An average citizen can bring an idea forward. And then that idea or that legislation succeeds or fails depending on a whole number of factors. But the support of supportive organizations, supportive individuals, constituents are really the most powerful factor in when an idea or a piece of legislation passes or fails. So just wanted to iterate how important our voice is in advocating for the issues that we care about. It matters, part of the democratic process, because your members, your legislators work for you. They work for us. We elected them to hear from us. So the role of advocacy and the role of just raising awareness generally really leverages government resources, can leverage government resources to scale. It can reform public systems. It empowers us as constituents to use our voice, educates lawmakers, positions organizations, positions parents, positions families as really kind of the experts in the, as a resource to a member of Congress or a state legislator or any decision maker. And there are lots of levels of influence with raising awareness or with advocacy, well beyond just elected officials, but just wanted to share that here are some of the elected officials that we can influence directly with our insights and with our experiences and with our knowledge. And to share a little bit about what we do at the national level and in our support to our state chapters. So we influence state government. So the governor, state legislature, we've often worked with a lot of our state chapters in helping them figure out the best inroads and the kind of what kind of advocacy could be done at the state level or with specific committees or with state agencies. And then at the federal level, we at the national office do a lot of advocacy at the federal level. We engage our state chapters to help us in those conversations as well. So the Senate and the House, and then also the administration. So, and at the bottom is a link if you want to find out who represents you at the state and local and federal level as well. So those are a link to just, I think you enter in your zip code and you it'll take you to who represents you, all of that. So, and then what does that really look like? Advocacy and education can look like a lot of different things. It takes a number of different forms, from writing an op-ed in your local paper or online, to voting. There's a really big form of advocacy, to lending your expertise, to directly maybe meeting with a legislator, to participating in Child Abuse Prevention Month activities in April. I know that your state does a lot of activities around Child Abuse Prevention Month in April, so you probably see a few pinwheels laying around town, around the states, but just wanted to share that there's a lot of opportunities to engage that month as well, which is advocacy. So preventing child abuse and neglect and other ACEs seems big, but we know that prevention is possible, and raising awareness is one easy way that we all can take action. And today, if you are so inclined and you want to take action, if you want to hold up your phone and click on the link, this takes you to our Policy Action Center. And there are two alerts in there right now. One is this one, thanking your member of Congress for passing the FY26 appropriations bill that just passed last week. And then the other alert that is on there is for you guys. It is a state-specific action that you can take, and it is for Child Abuse Prevention Month, but feel free to do that one. So the first one is federal legislators, and then there's one for state. And if you enter in your name and your home address and your zip code, it will take you directly to your state legislators as well as federal. But it'll take you to those, and you can send an email super quick. You can leave the pre-populated information that's in there and send it, or you can edit it as you want. So yeah, again, there are two in there. Feel free to use both. The first one is for federal legislators, and then the second one is specific to Rhode Island state legislators. To send a message to your state members, letting them know how important prevention is. It's really just a statement about that prevention is essential and raising awareness of what that looks like in state policy. So please take action, share this link if you want to, come back to it. We add different alerts in our Policy Action Center. They're typically federally focused, but right now there's a state one in there for you guys. And I'm going to take a look in a second to see how many of you took action. So it's really that easy. That's one way to just send an email to your member and take action and raise awareness. What's really cool about sending that email is that you might get on your federal or state legislators' newsletters. So you might get on their email list, which is what happened to me. And now I get to know what their priorities are and what they're thinking of. So I'm from Minnesota, so I have my two senators, I get their newsletters now and get to hear what's happening, what their priorities are. It also is just a really good way to raise awareness to a member. If they get so many emails or so many contacts about a certain issue, it raises that issue kind of goes up on their chart of priorities, and they pay attention to it. So your voice really does matter. And we have some time for questions and answers, but I wanted to do two things with you guys first. Somehow to stop sharing. Sorry. Stop share. There we go. Now you're all back in front of me. Just wanted to share the quiz that you guys took at the beginning, or even just talk through if there's any questions you had about that, but I can pull up the results and kind of some of the answers for that quiz. And then also want to see how engaged you guys were in the advocacy. So let me find this pop quiz. Okay. Share. Back on the screen. So the quiz that we took at the beginning was had 5 questions, and the first one was, which is true of adverse childhood experiences? Select all that apply. The only one that was wrong is that ACEs are not preventable. The other 3 were correct. So a few people did select ACEs are not preventable, and I hope that you learned throughout this that there are ways to prevent it, there are ways to mitigate ACEs, and there are lots of ways to support families. And then what is an example of the impact as an adult from an adverse childhood experience? It was all of the above. Heart disease, obesity, behavioral challenges, and risk for substance use disorder are all could be the impact of ACEs. And then true or false, you all got it right. Feeling supported by friends is a positive childhood experience. 43 said true. Fourth one, primary prevention policies and activities are designed for the general population to provide support. That is also true. And then what is advocacy? This was all of the above as well. Engaging others to support a cause, helping policymakers find solutions, or educating and informing decision makers. It is common that many people select educating and informing decision makers because that's usually the common thing we think about in advocacy, but there are lots of ways to raise attention and to be an advocate. Well, thank you. I will open the floor to any questions, discussions, feedback, thoughts.
I want to thank you and Anita very much for being here today and teaching us about ACEs and what we can do next. Thank you.
It's our pleasure. Thank you for inviting us, and we hope that the information was valuable and meaningful to all of you. And hopefully you can walk away with something, whether that's knowledge or something that you can do a little differently from what you've heard today. And if you have any follow-up questions, feel free to reach out to Kelly and I. Kelly is your policy guru, so any policy and advocacy related question, feel free to direct to her. She is amazing. And let us know if we can support you in any other way. I saw that Philomena made a pitch for this Friday, or Viviana, for a CAP month convening. So just wanted to point that out. And it looked like that we have answered all of your questions in the chat. Thank you, Jordan, for keeping up with putting all of the links. And Kelly, you were so good at the beginning too, while I was presenting, answering some of the questions. But if we have missed anything or you have any follow-up questions to us, don't hesitate to reach out. And stay safe and warm this weekend.
Yes. Thank you all. Yeah, it was just a pleasure to be with you all in this really important work and in this really important time right now. So thank you.
Thank you so much. And
thank you.
Thank you. And we'll get the slides to everybody. And
awesome. A warm thank you to all. Thank you.
Thank you,
everybody. Have a nice night or day, I should say.
Thank you.
You as well. Bye.
Bye.